Welcome to another installment of IPC TOUCHPOINTS, an expert insights series brought to you by Georgia Pacific. I'm your host, Abhi Zadav, Director of Healthcare Insights at Georgia Pacific. Today's topic is how standardizing IPC processes can help alleviate staffing challenges in post-acute settings. We have the pleasure of having Missy Travis here with us. Missy is a seasoned infection preventionist and the founder of IPC Consulting. And without further ado, let's jump into this topic. So we've all seen how post-acute facilities like skilled nursing homes, inpatient rehabs, independent and assisted living facilities have had to deal with staffing challenges. Can you talk to us about how standardizing IPC process can help alleviate those staffing challenges?
Yes, so I think when you standardize processes, you make the most efficient use of your time and you create consistency, which then you're going to be able to rinse and repeat, which over time is going to save you time because people know what they're supposed to do. They've already done it. It's duplicatable. And then I think with consistency, once you have something in place that is consistent across the community, across the facility, everyone's doing the same thing, and it really creates more of an efficient process.
And that's so important. Consistency is the key here because some of these staffing challenges are not going away anytime soon. So what can facilities do to get back on track?
Well, I think one of the things that you can do is just make things easier for staff. Make it easy for them to comply. A part of that is creating those consistent processes, but just have products that make it easier, have things that are readily available so that they're not having to work so hard. The other thing is I think many people initially say, well, we need to hire more staff. And I think in some instances that is appropriate, that you do need to hire more staff. But I think first, before you go to that step, you need to look at where you are and see what you can do with what you have, because it's not always feasible to just hire more staff. And I think looking at your current staff and equipping them with the knowledge and the resources that they need is going to make improvements, and also just empowering them to be a part of the infection prevention program. The other thing is being more proactive and less reactive. Having processes in place, or educating people beforehand so that you're not trying to go back and always be reactive when things happen. Everyone knows what to expect. That kind of goes back to that consistency. I think whenever we look at our standardized infection prevention processes, most of them are the same. They haven't changed. We may have changed products. We may have added a few things here, subtracted a few things, but if people know the basics of infection prevention, you're going to be able to create a successful team if everyone knows those basics.
Missy, I like how you describe the importance of standardization. So how does that apply when post-acute facilities might review and select products, for example?
Yes, so I think when we're talking about having less staff and or inexperienced staff, then even more so do you have to have that team effort to be able to have success. And so if you standardize the products, when you have new staff coming in, they know what to expect. And also if you have temporary staff and they already know that this is the product that you're using, they know what to expect when they come back as well. I think it's important to remember that infection prevention isn't a solo act. Typically, the infection preventionist is not the one that's actually doing the work. So it's important to call in the team. And whenever you're selecting products, you want to get their input because they're all using the products for different things. If you think about cleaning and disinfection, for example, you might have nursing staff that are using the product to clean resident care equipment. And then you also have environmental services or housekeeping that might be using that exact same product to clean a room or to clean something else. So they're each going to have a different perspective. And so I think having their involvement when you select the product is critical. And also the infection preventionist knows what organisms are present in terms of HAIs and in the community. So they also have to have a say in what product you're selecting because they know what would be most appropriate.
And so because there are so many people involved here, it's important to make sure they're familiar with hygiene and the importance of reducing HAIs. Can you talk to us a little bit more about that?
Yeah, so I think regardless of what type of staff you have in place, we have to remember for our residents, they deserve to get the same standard of care regardless of who is taking care of them. And so products and processes are powerful tools that we can use in infection prevention that make it easier for those staff to do the right thing. Certain products we know support infection prevention processes, but we also know that they have to be used correctly and consistently. And so you still need that element of education as well. So you need that initial and ongoing training related to HAI prevention as well as the products and processes that are being used.
So you touched upon products, but you also talked about training. How important do you consider staff training and reminders?
I think it's very important. We are all human and prone to errors, unfortunately, and so helpful reminders for those busy days I think are critical, and visual cues. I actually had a hand hygiene committee at one facility that we came up with just, a hand gesture that they could do to remind other people to clean their hands, just taking out that confrontation type element where you could just, put your hand up and make a signal and someone would know what you were saying, just to remind them, hey, I didn't see you do hand hygiene. And with that initial training, another thing that I've done with new employees is use fluorescent gel on their hands and then have them do hand washing, and they come back and we look at it under the black light to give them a baseline for where they are when they start, and so that we know automatically, okay, this is what we need to work on going forward. So again, just being proactive in your approach, not expecting people to be perfect, and being willing to coach them so that they can be proficient.
Those are some great insights, Missy, and you've helped us in this topic to address staffing challenges and also talk about how to review and select products. Can you tell us a little bit about how you recommend post-acute facilities to get started?
Yeah, so I always recommend starting with a gap analysis, which is basically just looking at where your gaps are in your program. You look at the regulations, the recommendations, and then where are you at the facility? Where are you, and what is that gap in between those two? Because once you have that gap, then you can make a plan. I definitely wouldn't support someone just adding a lot of resources and products before they've taken a good look at where do you stand right now and what do you actually need for your program to be successful. And this can be done in conjunction with a risk assessment. A lot of infection preventionists are familiar with doing that risk assessment. And I've gone through this process every time I've started a new role as an IP, is just taking an honest look, where are we, where should we be, and then what products or processes or resources can help close that gap between the two.
Those are some really valuable insights you shared, Missy, and thank you for meeting us here at Georgia Pacific. As we like to say, healthcare experts meet hygiene experts, and we value experts like you who want to keep the healthcare community informed. Thank you very much for your time today.
Thank you for inviting me.
And I hope you folks will join us for additional installments of IPC Touchpoints. Thank you.